on day 2 of 25 days 25 syndrome. Today we are going to talk about fetal alcohol syndrome, which is the leading cause of intellectual disability in USA. It is one of the spectrum of disorders under the umbrella term of fetal alcohol spectrum disorder FASD. It contains 5 disorders. Number 1 is FAS, which is the fetal alcohol syndrome. Number 2 is PFAS, which is partial fetal alcohol syndrome. Number 3 is ARND, which is the alcohol-related neurodevelopmental disorder. Number 4 is NDPAE, which is neurobehavioral disorder associated with prenatal alcohol exposure. And number 5 is ARBD, which is alcohol-related birth disorders. If you see the etiology, as we all know, alcohol is extremely teratogenic to a fetus, and there are no studies that demonstrate a safe amount of alcohol that can be consumed, and there's no safe time during pregnancy in which alcohol can be consumed without posing risk to the fetus, as the effect of alcohol is wide ranging and irreversible. So if you see the risk factors, usually women who's more than 30 years of age and someone who had already given birth to a previous fetal alcohol syndrome baby, they have like double the risk of same syndrome occurring in their subsequent children as well. And women who are genetically susceptible to metabolize alcohol slowly maybe can also be at a higher risk. If you see the pathophysiology, due to ethical reasons, the studies are limited and most of our data are from animal models and they're associated with alcohol exposure. And they have shown that when there is an alcohol exposure in the first trimester, there is increased facial and brain anomaly, and in second trimester, there is increased incidences of spontaneous abortions, and in third trimester, there is decreased height, weight, and brain volume. If you see the physical findings of these baby will be in terms of facial features, they'll have low nasal bridge, micrognathia, short palpebral fissures, thin vermilion borders or upper lip, and smooth philtrum. These babies may also exhibit microcephaly and pre and post-mental developmental retardations. These babies can also have limb dislocations and their heart defects where atrioceptive defect may be more than ventricular defect, and they can also have vision difficulties or hearing problem. In case a baby is severely affected by alcohol, then they can also develop holoprosencephaly due to impaired migration of neuronal and glial cells. If you see the treatment, as I already told you, the effects are irreversible. We do not have any treatments and it is incurable. The utmost we can do is give supportive therapy to the symptoms that are exhibited. Like, for example, in case of hearing problem, we can give hearing aids. In case of speech problem, we can give speech training with speech therapists. And in case they have ADHD or depression, we can give medications for it. And if they have anxiety and aggression, we can give neuroleptics. That is all we can do. We cannot do anything more than supportive therapy for these patients. So the best way, best way to avoid fetal alcohol syndrome is to avoid taking alcohol if you're or want to expect a baby. So that's it for today. I hope you all like this video. If you do, please click the subscribe button and bell button to receive notifications when I go live or I do a new video. So that's it for today. Thank you. Bye bye. Have a great day.